It is an exciting time for treatment of platinum-sensitive patients with ovarian cancer. We have had recent approval of bevacizumab in this space, and we have had recent approval of PARP inhibitors that also are changing the landscape very rapidly. We'll see label changes, I believe, as we go. We recently had approval of a PARP inhibitor that would allow us to treat patients with platinum-sensitive disease. We also have a second PARP inhibitor that's been recently approved that would also fall into this space potentially. And I think it's very interesting to look at how we make that decision between incorporating bevacizumab versus the PARP inhibitors. And to me, this is a very fluid area right now, and I think many clinicians are really trying to look for determinants of the best patient for the best regimen, and I'm not sure we've completely worked that out, frankly. When one reviews the PARP data, it is really interesting because it's such a fast-changing area. I think that you'll see continued changes in the indications as more data comes online, and you'll see where the indications become more similar for the three PARP inhibitors. So the first PARP inhibitor to be approved over a couple years ago now was olaparib. We then had rucaparib that was approved just recently, and then just a couple weeks ago we had niraparib approved. So it's very interesting in looking at this. One of the indications has been this concept of maintenance in platinum-sensitive disease. So treating them with chemotherapy, treating the patient with chemotherapy, looking for either a partial or complete response, and then switching them to a PARP inhibitor at that point. The original data with olaparib for approval was actually in patients fourth line and beyond, so it's a little bit different in looking at that, and some of those patients are actually platinum resistant. So I think one has to be careful in terms of looking at the different indications and looking at the different PARP inhibitors, and you definitely have to keep up because I think you'll see continued changes probably almost on a yearly basis with the number of trials that will report over the next couple of years that will change the labeling for these compounds.